Hi, my name is Michael. We're going to be doing our school age presentation.
I'm Ariana.
My name's Abigail.
And my name is Andres.
And hopefully you learn some new things and you enjoy our presentation of school age children.
Psychosocial development on socialization. So kids around this age, 6 to 12, usually enjoy playing games, cooperative play, playing in groups. They usually socialize with kids within their age range. Um, they like to form social relationships. They're very social when it comes to being outside or in the group setting. Um, they like doing projects with one another. They're very involved with their friends. So if their friend needs help with something, they will try to help them or try to figure out a solution for them.
Okay.
Language. Pulling up my notes. So kids around this age range usually develop a language skill through thinking, social interaction, storytelling, and support from school and peers, all of which help shape who they are. So they by going to school, they start thinking more logically, which helps them understand and use language better, including grammar and vocabulary. Talking with friends and adults helps them learn how to express themselves and understand how to use language appropriately in different situations. Children often change how they speak depending on who they're with, picking up new words or phrases to fit in with their friends.
That's good. For like the psychosocial development, children don't just all of a sudden become like develop socially or cognitively throughout their life. It's a slow progression, and there's been a ton of different people who have like come up with theories on how children and people develop their consciousness and stuff like that. But I decided to stick with Piaget, or we'd be here for 2 hours as I went through all 10 of the other ones. I think it's Piaget. Anyway, starting with like stage one, which is actually the most complicated of them. And I thought about, just going over our age group, which would be like the school age, but it doesn't quite make sense unless you see the progression of it. So bear with me for a second. Stage one, which is the sensory motor, which is going to be like birth to 2 years old. They start exploring things through looking and touching. They learn object permanence. That's something, even though they can't see it, that it's still there. They can start to not like strangers during this time. They start to be like, whoa, who is that person? That first stage is actually cut down to 6 stages. There's stage one, which is reflexes, which is birth to 2 months. They can really only understand their environment through reflexes such as sucking, because that's really all they can do. Stage two, which is primary circular reactions, which is 1 to 4 months. They coordinate through like reflexes and sensations, kind of like finding their thumb, and they're like, this is great. Stage three, which is secondary circular reactions, which is going to be like 4 to 8 months, starts to repeat actions like eating a toy. They're like, oh, I like doing this. This is good. Stage four, which is coordination of secondary schemata. Hopefully that's how it's pronounced, which is 8 to 12 months. They start to notice that when they start doing certain things, it does things. Like when they shake a rattle, they're like, oh, that makes a noise. I like that noise. They notice that association. Stage five, which is tertiary circular reactions, which is 12 to 18 months. This is when they'll start doing that weird trial and error approach to life, and they'll start to notice that things will get them attention. It's that age where they get into trouble. They're like, if I do this, I'll get my mom's attention or my dad's attention type of, behavior. Stage six, which is the inventions of new means slash mental combinations. They start to notice the correlation between objects, such as knowing that like a plate or setting the table means dinner time, that kind of stuff. The important concept to come out of, the sensory motor stage is that the child develops object permanence and knows that even though something is hidden, it's still there. In stage two, which is pre-operational, it's going to be like 2 to 6 years old. They start to use language, can think of past and imaginary things. So they're just able to picture things in their head. They have no concept of time. And I think that's also because when you're young, you've only lived so many hours. So you don't quite get it yet. You can understand that symbols represent certain things. It's during this age that they really start to think for themselves and develop their language skills and the ability to think of like past and imaginary events. They become very imaginary and being like, oh, I have this imaginary friend, or I want to be a princess in a huge castle, that type of thing. Um, During this stage, you should be engaging with the child to help engage them and help them with their language skills. It helps them develop their imagination and their thought process and, prepares them for the future. Um, Continuing on to stage 3, which is like concrete operational. This is going to be 7 to 11, which is basically going to be our school age children. They start to have regular conversations. This is whenever it's not just baby talk. Like, it's not quite perfect, but they're able to follow most conversations pretty well. They start to incorporate logic into their thinking, and they start with their arithmetical, basically mathematical operations, plus, minus, division, stuff like that, simple stuff. Because the child is able to determine possible consequences and able to think properly, you should make sure to incorporate them throughout if they're in a hospital, to make sure to incorporate what you're doing with the child. You don't just want to do whatever, be like, hey, I'm doing this. This is why I'm doing it. Just keep them incorporated. You should try to explain the disease process to them in simple terms because they're not going to understand complicated stuff, and just tell them the truth whenever you're doing things. If it's going to hurt, tell them, hey, this is going to hurt. If you're lying to them, they're just going to learn to distrust the healthcare system, and that's a whole nother issue. So they're really developing themselves, like kind of like it says, concrete operational. They're developing that foundation of their, who they are and their mental status at this point. And then stage 4, which is formal operation, which is 12 to adulthood, ends in this is the final form. They don't need concrete objects to make rational judgments. They can think of hypothetical and deductive reasoning, think abstractly. During that time, you really want to incorporate them into more decision making, help them to encourage to be adults, be like, hey, this is my body. I kind of want to have at least a say in what's happening and stuff like that. So there's all these stages, and they just slowly develop in who they are, how they think, and you kind of have to notice how it all goes to determine if there's an issue. If they're not developing, it's like, okay, something's wrong. Let's figure out what it is, and let's see if we can help them. And if we can't help them, we just accommodate them and, help them to live as normal as a life as they can. When it comes to physical development, um, their vitals are similar, but not quite the same as an adult. Their heart rate is going to be between 75 and 118. It's going to be a little bit faster because they're a child. They're running around. Everything's not quite as developed. Same with the respiratory rate, which is going to be 18 to 25. Their BP, which is going to be a systolic of 97 to 120, or a diastolic of 57 to 80, which is close to the adults of 120 over 80. Their temperatures pretty much going to be the same, 98.6. There's no like they should be this weight at this age at this time. The important thing is that they're gaining at least 3 to 5 pounds each year, and that they're growing 1.5 to 2.5 inches per year. It's kind of like whenever you look at the growth chart for children, the important thing is that they're following a trend, and that they're not going crazy up high or crazy low. So they're just following that trend. Some age appropriate toys during this time. It's gonna be like Uno. Although Uno's gotten so complicated, if you look at it, there's like 12 different versions of Uno. It's crazy now. Word searches. This is great for helping them to develop their language skills further, being able to think abstractly and critical thinking because they have to find words in it. Walkie-talkies, that's just a blast. Legos creates their imagination. And if you guys have ever played a game called Ninja, it's where, like, I don't know, you stand in a circle and your hands are your lives and you only get to move during your turn. It's great. Teaches them hand-eye coordination and just quick reflexes. It's a good time. So yeah, some things to keep in mind for school age children during their ages. You want to start using much more safety equipment when playing sports because they're bigger, they're faster, they can hurt themselves easier. So use helmets, use knee pads, elbow pads. Keep them hydrated. They're very active. Don't let them swim alone, even though they can probably swim. Don't let them swim by themselves. they'll drown and it will be horrible. Teach them that road state safety stuff because they'll be walking around. Teach them about dangers of firearms and just what to look out for. Have a fire escape plan. Be like, if there's smoke, do this because it happens. And yeah, that's that.
So we just placed some pictures, just describing the activities and games, as Michael had mentioned, Uno and word searches being pretty popular. With these games and activities, the child during this age is very much into the teamwork and collaboration phase and understanding that working together, socializing, is sort of how they learn. And so Uno and word searches will help define that. So working together, working as a team. And then, as Michael said, as far as the word searches go, helping think outside the box using that abstract thinking, helping with the association of letters and memorization of words and spelling as well. And obviously, with research, word searches, you can do them at different age ranges through that school age, since between 6 and 12, the 6-year-old's not going to have that same level of word search as that 12-year-old might. But it is both great opportunities for collaboration and teamwork.
So for the physical development, some major development tasks of fine and gross motor skills. So around like 6 to 7 years old, that's when they like to like paint, draw. That's when they learn how to like jump rope, ride bikes, tie shoelaces. From 8 to 9 years old, that's when they like to again jump, skip, chase, like play tag and stuff like that. And that's when they also learn how to like dress and groom themselves. That's when they're very specific on what their appearance is, like what they like to wear, what's in the new trend, leading to 10 to 12 years old, where they like to write stories, read books, and being on their phone. I know like a lot of children at that age, even younger, like during this school age where they have phones nowadays, especially like iPhones and iPads. So that's when like kids like to watch YouTube videos, play Roblox, Minecraft, all those types of games. And also, what would cause a delay? I would say balance and coordination delays, which are increased of falls. So, difficulty with these activities, such as accurately coloring, drawing, not being able to use scissors properly, or solving puzzles. So that could be like a disability if they were born with it, or depending, like I know like people say social media and like them having electronics could be a delay. um from experience, like my cousin, he I think since social media nowadays is very involved in society, he is having delays in tasks and stuff like that, which my fiance is actually tutoring him because of this delay. Like he wishes, now he realizes, since he's of age, he realizes that he probably should have not had used his iPhone and iPad so much so he can actually focus on his studies. Um, Also during this age, um, around this time, this is when they gain confidence. So this is who they realize who they know. They know their body parts pretty well. They learn new talents and interests. Like around this age, this is when people know what types of sports they want to play, um, if they want to join any clubs, basically anything that they're interested in. And this is when they know more about like academics, like why it's important and like what it leads to. Like it leads to high school, it leads to college, and then them some. So yeah.
Alrighty, so as we know, children during the school ages are growing rapidly, and it is super important to educate the parents and families on the nutrition of their child. I feel like, especially with this age group, this is where a lot of those kids fall off on as far as nutrition and health goes. So we want a decreased caloric intake. I know that sounds kind of backwards, but we need more nutritious snacks throughout the day. So these kids are going to be burning energy throughout the day. So as like an adult where we're going to eat 3 meals a day and that will keep us full in our energy, these kids, because they're constantly going, you're going to want to have those smaller caloric intakes and have them more frequently throughout the day. So it is important to educate of the proper nutrition and to the children and the primary caregiver, whether that's grandma's house, the babysitter, school, anywhere that that child may be. So child obesity has tripled over the last 40 years with a 20% of school age children. Now that could be whether it's the food that the parents send to school with them. It could be that Arizona or America in general, their school food systems are not that great. I know there's been works over time to try to increase the nutritious value of school lunches, but it doesn't always seem like it's headed in that direction. It also could be financial stability as far as what you're sending your child to school with, as far as nutritional intake. Parents assist in shaping the child's feeding and mealtime practices, so it's very important that that parent and child or that the child has a role model in their parent when it comes to eating. So if the child is watching mom make a smoothie for breakfast or toast and eggs, then that child is more likely going to be wanting to be curious and want to try those things or eat those things because they see mom and dad having those healthy habits. Same with meal times. So if we see that mom and dad are setting the table and everybody's going to sit down and eat and everybody's eating the same thing, that child is more likely to follow along with that rather than, oh, I'm just going to give my kid this McDonald's and sit at the table while I go sit in my room and eat this. That child is just going to know that that's normal and more likely than not have those non-nutritional values. As far as sleeping goes, it also plays a huge role in the child's development. It is recommended that a child from school age, anywhere from 6 to 12 years old, gets an average of 9 to 12 hours of sleep. I know my kids at home, it's hard to get them that 9 hours, even trying to put them to bed early, especially with the sun not going or the sun is going down earlier now, but like during those winter months when it's dark, or even the summer months when the sun's still out at 7 o'clock, 7:30, and you're telling your kid you have to go to bed. But the brain actually regenerates and continually is growing while they're sleeping, so it's imperative that they are getting the adequate amount of sleep. Data has shown that with the appropriate amount of sleep, there will be an improvement in attention, behavior, learning, memory, and emotional regulation, as well as mental and physical health. So, can just imagine like when we don't get enough sleep and we're tired and we're like, oh man, I'm not running on all four cylinders today. If imagine these little kids that are on the go, 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 and you wonder why they're having a temper tantrum, or you wonder why they're crying, or they're just not listening, but most of the time it's due to that lack of sleep. It says lack of sleep shows less attention and appropriate behaviors in school, becoming a distraction while not being able to focus. So a lot of these kids you're going to notice that aren't getting the sleep, that are staying up, they're going to be falling asleep in class, they're not going to be paying attention, they're going to have a lot of distractions, or they're going to become a distraction to their classmates. Michael, on the next slide, I did just put briefly the a couple resources I found. So everybody knows the My Plate. You can go online. A lot of the schools, when they go to the nurse's office at the beginning of the school year, or at least they used to, they would hand out or go over some educational information as far as nutrition for the children. So it's going to say that half of our plate for children's should be fruits and vegetables. So if you were to cut that plate into fours, half of it should be fruit and vegetables. There should be a small portion of protein, and the children can mix that up. Um, where did I for the protein? Okay, include different foods like seafood, beans, peas, lentils, nuts, seeds, soy products, eggs, meats, and poultry, and that would be all included in that protein portion. And then as far as grains, trying to incorporate whether it's a small thing of rice with dinner or oatmeal for breakfast, toast, not too much grains because you don't want to like carb overload these kids, but having a well balanced plate. And then when children these age, when they become thirsty, trying to stay away from those sugary beverages, which are just going to accelerate that behavior and emotion in class. So they're suggesting low fat to fat free milk, or water. Now, if you have to use lactose free or fortified milk products, that's okay as well. But just trying to stay away from those excessive cornstarch, like high fructose corn syrup drinks, juices, Capri Suns, those kinds of drinks. And then another thing that I found sort of just broke it down by boy to girl from ages 2 to 4 and from 6 to 8, just so you can get like a little bit of a visual as far as like how many grams of vegetables should be vegetables, protein, grains, just so you can see as far as like an average child that age range should intake. So the more active they are, the more that they're going to need to take on that in caloric intake as well. And then finally, it's important to find ways for that child to be active and to move their body at least 1 hour a day. Try walking to school. Obviously, that could be pretty controversial in today's time that we live in for parents, but riding your bike, playing a sport with friends. So keeping these kids active and out of like out of being in front of the TV or their tablets and iPads, really will help their cognitive development as far as not just killing those brain cells in front of a visual screen for that instant gratification, and really going back out to the streets and playing sports and doing things that kids used to do growing up. Then the next slide that I have, I believe, is our vaccinations. So vaccination advocacy is huge in the school system. It used to be that in order for your child to even be enrolled into the school system, they had to be up to date on their vaccinations. As far as vaccination goes for school-aged kids, I have a little bit of a mix here because you get multiple doses throughout the range of age that we were assigned. So between 4 and 6 year old, they're going to get their 5th dose of DTaP, which is your diphtheria, tetanus, and pertussis vaccine. They'll get their 4th dose of IPV, which is the inoculated polio vaccine. COVID, that can be given, it says 1 or more doses, but basically you'll get that every year, just like the flu vaccine, if you so choose to as that parent. Influenza, 1 dose annually. The MMR, which is your measles, mumps, and rubella, they should get their 2nd dose by 4 to 6 years old. Varicella, which is your chickenpox vaccine, they should be getting their 2nd dose as well at between 4 and 6 years old. Tdap, which you will get at 11 to 12. So that differs from the DTaP. So this is Tdap, and that's more closer to your adolescence age. HPV, which is the human papillomavirus, it's a 2 dose series, and you can start that series about 11, 12 years old, but you can actually start it as early as 9 years old now. And then your meningococcal vaccine, you're going to get 1 dose at 11 to 12 years old as well. And this information was pulled from the CDC. And I did put a little picture on the next slide that most doctors' offices use. And you can just see starting from birth to 18 months, it goes through, and even further down to 18 years of age. It just goes through the little check system that the doctors use to follow for the vaccination schedule for your children.
Who's got this one?
I did not. I was like, I did not fill that one.
So for safety considerations and injury prevention, the book did state that the leading cause of death includes automobile collisions, and that it sometimes has to do with, car seat guidelines. Ages 0 to 7, you usually, you're facing, 0 to 7 months, you're usually facing forward car seat or harness. And then ages to 12, you use a booster seat until 4, 9, but they need that actual height. They have to use a booster seat. For head injuries, like Michael stated, use your helmet. Make sure that you're teaching your kids about crossing the street, how to look for both ways. Just educate the parents on concussion symptoms and treatment to make sure that if their kids do get hit on the head, they know what to look for and what is an emergency. And then babysitting readiness skills to learn. So fire safety, child observation, basic first aid, CPR. Just teach that babysitter the safety of your child between those ages to make sure that those kids are also following the guidelines or the rules the parents input on them as well.
Okay, for unique considerations for hospitalization. So let's say your kid around this age goes to the hospital. Um, as nurses, we want to let the children investigate medical supplies. We want to ask questions, practice methods for coping. They're going to ask about their illness and their treatment. It's important for them to like keep it fundamental, tell them everything, but keep it very like layman terms and how they would understand it. Um, you want to be you want to know what concerns they might have, which can include being separated from their parents, because most of the time these children won't be with their parents. They're going to be with other medical professionals, like mostly nurses, doctors, um, social workers, etc. So you want to know that. With their condition or illnesses, managing for pain. So a lot of these children will experience pain, anxiety. So you kind of want to let them know how they can cope with that. It could be pharmaceutical things, non-pharmacological things. You kind of want to, just like how you do with adults, you kind of want to do with children, a little bit more empathetic and um, understanding with children because it's a little bit new to them at the hospital. They do have aware of what's happening, but um, it's still a little new. You want to know how kids feel about skipping school, not seeing their friends, because that is a little different. Um, especially if you're in the hospital. Sometimes you're there for just one day, but most kids will be there for like a week, a month, maybe even a year. So we want to kind of ask how they're feeling, what's going through their minds, because sometimes their parents are not there due to work, other obligations. Um, and then you also want to ask them which types of aid are needed in order to recover.
Mm.
Uh, Also, since it is a new environment for them at the hospital, a lot of these kids might not be able to sleep. So it's important for them to ask questions on what they need. Like, do they need a stuffed animal? Like what's their routine? So you kind of want to make it feel like at home in a way for them. So we want to be able to give that therapeutic communication, um, just be able to make sure as a nurse, even other healthcare providers, to be able to give that comfort, safe patient family care surrounding. And, this could be difficult for them. So we want to make sure that we're giving them all the necessary information that's needed, giving them comfort care, and making sure that, we're there for them. They're not alone because it could be hard for these patients and a lot of these kids. So, yeah.
You make a good point, Ariana. So I know from my perspective working in a pediatric hospital, so we have patients when they know that they're going to get admitted, they basically pack what looks like their home up to bring with them. They will bring blankets, pillows, stuffed animals, their favorite snacks, toys, things like that that'll make it feel a little more homey for that
Mhm.
week, months stay that that they're going to be experiencing. Sometimes those tough white linens and the dark rooms and things like that can be a little eerie for them. But yeah, like you had mentioned, making sure that we do the best that we can as healthcare providers to make them feel at as much ease and feel like they're at home as much as possible, to make them feel as most comfortable as needed.
Mhm. Yeah. And these are references. Anybody have anything else to add?
Yeah, I was trying not to interrupt when one of you was talking about lack of sleep, nutrition, how that affects and misfocus the kids in school. That also leads them to misdiagnose them with ADHD as well because they can't focus, they can't
Mhm.
stay still or anything, and that's due as well to lack of sleep, lack of nutrition,
Mhm.
lack of interaction at home. So it also just affects their mental health as well.
Mhm.
Thank you for pointing that out, Andy.
Yeah,
Mhm.
absolutely.
Also, sorry,
You're
they
good.
also during that age range, they also get 20% of those kids get diagnosed with dyslexia, which is hard for them. Like they can't read properly, affects their reading, their writing, and their learning ability as well.
Very good. Yeah, I think it's important too that, when they are having these small, minute assessments through those school age children, that they are pointing these out, that there are those resources needed for those families. Um, Whether it be the eye exams or the state testing or anything like that, or having those teachers be resourceful and mindful to watch out for those cues and hints that I don't think Johnny's doing so well in class, or, he's not reading to the level that we feel that other students of this age range are reading to. So just making sure that our educators are educated as well, to be able to be point takers for those parents too.
Mhm.
Yep.
Yeah, absolutely.
And let's face it, guys, who didn't like getting those vaccinations in the beginning of the school year? I know I did it. I know I did it.
Right? I feel like at that such young age, when we do get that majority of the vaccines, it's like, do we really even remember getting those as many vaccines as we did from like 0 to 18 months?
I mean, I do remember being curious at around that age and giving my mom a hard time. That's all I
Yeah,
remember. Like I would
curiosity is huge.
cry all the time and I wanted like I didn't want something or I wanted something, I would cry. Or when it came to those vaccinations, I would like pretend I was sick and I didn't want to go. But that's fun.
Mhm. All right. Yeah. Good job, guys. I think we did like a solid